Pregnancy is usually divided into 3 trimesters. You have 9 months. So first 3 months, second 3 months and third month. First thing we need to understand is 9 months is not equal to 36 weeks. It is 40 weeks of pregnancy. So it's usually about every 3 months, it's going to be 13 weeks of pregnancy, 13 plus 2 or 13 plus 3 days of pregnancy. Most of the questions we ask is, can we travel? Can we eat that? Can we do that? So first thing about food, universally, please do not eat outside food. We do not want infections to come and end up with antibiotics. But saying that, whatever you want to eat in moderate amounts, you can take with decreased anything which can cause acidity, that is spices, anything which can be sour in taste, which can lead to more vomitings and more acidity. As the pregnancy goes, acidity is going to be more bland diet and less acidic diets. First trimester, when the vomitings are more, don't worry about the weight, and you should be looking at decreased liquids and more solids and short frequent meals. You can take 3 to 6 times a day, meal between meals, but make it as short frequent meals. That's the way to lead dive and prevent vomitings in first trimester. Second, sexual life. First 3 months, unless there is something gross, it is okay, but only thing what we need to understand is that less abdominal pressure. Avoid sexual life after 28 weeks of pregnancy because it can lead to prostaglandin release and preterm labor. And what is very important in pregnancy is travel. First 3 months and last 3 months, try to avoid travel, and if it has to be travel, it has to be a train journey, or 4-wheeler is definitely better than a flight or a 2-wheeler journey. Basically, whoever is driving should be knowing that you are pregnant and take you carefully on the roads. That is very, very important. And the next question, which is how to sleep, how to take care, what to do. As the pregnancy grows, the weight of the pregnancy is going to fall on the blood vessels of your body, and that can completely cut off the blood supply to your brain, and you can go into unconsciousness. So try to sleep on the left or right side, preferably on the left side. That is something which is important. And next question would be, as and when we go, the increased amount of urine which comes. Yes, first 3 months, that is be all right, but around 13 for 12 weeks, the increased urination is going to start, and which is going to be increased because of pressure of the pregnancy on the bladder. Urinary infections are also quite common in pregnancy, to avoid which we need to understand that drink lots of liquids, try to pass urine whenever it is possible. Do not hold urine for long durations. These are few things which you have to do. But most important, there are vaccines in pregnancy. There are 2 vaccines in pregnancy and 1 vaccine after the delivery. So the first vaccine, which is very important, is a flu vaccine, which we give after the first trimester, that is 13 weeks. That will cover the next 6 months of pregnancy plus the next 6 months of the baby till the baby starts receiving the vaccine for the flu. And in around 27 to 36 weeks, we again give a Tdap vaccine, which covers the tetanus, pertussis, diphtheria, and this is something which has to be given between 27 to 36 weeks of pregnancy. Post-delivery, if the lady has not received HPV vaccine, we give the HPV vaccine.